Hello everyone, this is Dr. Kishore Alapati. I'm a consultant colorectal surgeon working out of Institutes of Colorectal Surgery at Apollo Health City in Jubilee Hills, Hyderabad. Today I'm here to talk about colon and rectal cancers, their symptoms the patients would usually present with, and what are the diagnostic criteria or the different ways of how we diagnose the problem, and what are the treatment modalities that are available. For colorectal cancer, the most common symptom that we come across is usually bleeding through bowel habits. So, no matter what age it is, if you have noted persistent bleeding with your motion, or you have noted mucus, it's like a slimy material that is coming out along with the motion passage, then that is definitely one of the red herring sign to keep in mind. Fair number of times when this happens, most patients go and visit their primary care physician or a general physician. Usually you will be offered treatment for about 1 or 2 weeks. But even with conventional treatment, if you do not notice any significant improvement in your symptoms, or if the bleeding has not stopped, you continue to have mucus discharge with motion passage on a daily basis, then that is the time you really need to see a specialist like a medical gastroenterologist or a colorectal surgeon to be further evaluated in regards to these symptoms. So, apart from the bleeding and mucus formation, the other telltale signs that we come across for colorectal cancers are unexplained weight loss. Even though you're consuming your routine normal diet, you continue to lose weight, or sometimes you'll have a loss of appetite, which also adds for the loss of weight. Sometimes you might look pale, which means that your blood count has dropped, because bleeding is also one of the telltale signs of colorectal cancers. Unexplained change in bowel habits, which means that if until about 2 weeks back or 3 weeks back you were going for motion on a regular basis, and recently you've noticed a sudden change in the pattern of your motion passage, which can be either severe constipation or severe diarrhea, which means loose motions on a daily basis. So if you have any one of these telltale signs, then those symptoms definitely warrant an examination by a specialist, which would be either a medical gastroenterologist or a colorectal surgeon. The most important reason why we would emphasize on getting examined if you have any of these symptoms is, if you do have a problem, we would be able to identify it hopefully in its earliest stage. And as you all know, cancer is something when identified at the early stages, you would have almost a complete cure and be able to lead a normal life after having had a treatment done for that particular cancer. So, when you have noticed these signs again, and you visited your general physician and there is no improvement in your symptomatology, that is when you really need to come to a specialist to be examined. Typically, when we see these patients in our clinic, the routine examination is examination from head to toe. Apart from that, we do a specific examination of the abdomen, which is the stomach in general. And apart from that, we will also include a rectal examination, where a finger is inserted into the anus and identified to see if there is any hemorrhoids, or really there is a lump or a lesion that can be picked up when we do a rectal examination. After this is done, we usually go for a routine blood investigations, which would include a blood count, and also sometimes we include a stool culture, because infection is something that can cause either a bleeding or mucus in the motions. So after your routine investigations are done, the specialized investigations that need to be done is, the first one that should be done is a colonoscopy, wherein a camera is inserted through the anus and the entire large intestine is examined. So for this, you actually need a preparation. So after your initial consultation, if we think as physicians, we think that you definitely need a colonoscopy for your colon or rectum to be evaluated by a direct examination, then we will give you a prescription for medication, which would help clean up your entire intestines, and this is what we call a bowel preparation. After the bowel preparation is done, you come into the hospital, we schedule an appointment to get a colonoscopy done. This is done by usually the medical gastroenterology specialist. So when we do a colonoscopy, it is used as both diagnostic and a therapeutic maneuver in sometimes. What does that mean? Diagnostic maneuver meaning, when we do the colonoscopy, we will be able to look at the entire large intestine. We would be able to look at the inside of the entire large intestine. If we find anything abnormal at the same time, we would go ahead and biopsy it and take a look at it underneath the microscope. So even if it is infection, we would be able to look at it underneath the microscope and identify what type of infection it is. If we find a lesion or a mass, then we would be able to biopsy it, and we will be able to look at that underneath the microscope and make a diagnosis if it turns out to be a cancer. So therapeutic maneuver in the sense, if there are polyps, and again polyp is something that shows up as a mushroom if you typically look at it, the shape of it. And this mushroom over a period of time, which is scientifically proven, is what converts itself to become a cancer. So if we pick it up in the mushroom stage, then we would be able to remove it completely during the colonoscopy itself. Thus, by doing that, we have prevented a potential source of cancer in the future. So if we do find a polyp during colonoscopy, we will go ahead and remove it at the same time and check it underneath the microscope. If we do find a mass which has grown bigger in size compared to a polyp, then we would be able to biopsy it. So after the biopsy is done, then depending on the picture what it looks like underneath the microscope, if it does look like a cancerous or a malignant lesion, then we do routine X-ray examinations like a chest X-ray followed by a CT scan of the abdomen and pelvis. And if it is specifically for a rectal cancer, then we would definitely do a MRI of the pelvis to appropriately stage the cancer. Now, colon or rectal cancers do grade from stage 1 to stage 4. So depending on the stage, the treatment is offered, and the staging is more appropriately done either by a PET CT or an MRI scan in specifically for rectal cancer. Once after a diagnosis is made, that is when we would offer treatment. Sometimes you would do a combination of chemotherapy with radiation therapy with surgery. Sometimes straight surgery will be able to take care of the problem. Specifically for rectal cancer, we offer what we call robotic surgery. It is a high-end laparoscopic surgery which helps in complete and clear removal of the cancerous tissue, because we were able to see these cancer cells under a 3D enhancement. So the surgery is much better done compared to a routine conventional open surgery or a routine conventional laparoscopic surgery. The outcomes for robotic surgery for rectal cancer are very good, especially in males. The problem of erection or ejaculation has significantly come down, because we do what we call a nerve sparing technique when a robotic rectal resection is done. The one significant trend we have noticed in the Indian subset of population these days is the younger generation has shown more inclination towards developing much more aggressive rectal cancers. So as a matter of fact, in our practice, even if a young 30-year-old gentleman or a female comes into our clinic with complaints of rectal bleeding, we do not think twice to perform a colonoscopy in those patients, because we've noted rectal cancers in these younger patients that they tend to be more aggressive. And so if we pick them up early enough, then the treatment would be almost curative. But if it is delayed, or if the cancer has already spread into different parts of the body, then the chances of that person passing away because of the cancer is much high. So prevention is better than cure. We would urge everybody to go get a colonoscopy done, and based on the colonoscopy, identify what the exact problem is, and based on the problem, we would offer a tailored treatment modality, whether it is chemotherapy, radiation therapy, surgery, or a combination of all of these three elements put together. Thank you.